Hi there, everyone. I'm Dr. Scott Howard, Natural Health Chiropractic here in Lubbock. And on today's video, I'm going to try to address how to fix an SI joint. So I've been trying to do some videos that are addressing questions and myths and things like that on chiropractors. And so one of the questions is, can I fix an SI joint? So first, if you don't know, what an SI joint is it's the sacroiliac joint. So that's SI. And that is, let's see if we can see this, okay? That is, here's the sacrum, here's the ilium, so the sacroiliac joint. So that's the joint right, let's see if you can see that, right there. And so you can have the sacrum misaligned. It could be tilted down. It could be tilted back on the left or back on the right. You could have this ilium rotated forward, or you could have it rotated back, and it can get stuck there. So when you have this joint that's misaligned, a lot of times it will cause a reflex spasm of the piriformis, which then lays over the sciatic nerve, which then, when you have a muscle that spasms, that's touching a nerve, obviously that nerve is going to get irritated, and then you're going to feel where that nerve goes. It's going to be irritated, and that's called sciatica. That's not all the causes for sciatica, but that's one cause of it. And so sometimes people can rub the piriformis, and that helps the spasm reduce a little bit. But if this SI joint is not adjusted and fixed properly, then you're going to have recurring piriformis spasms. So the sacrum can be adjusted. You can have the lower lumbar out of place, and you can adjust that. Adjustment meaning you can put it back to its normal position, or you can do the ilium here. Now, a lot of times people will have patterns, and so they will develop a chronic pattern of every time you go in, and your question probably is, why do I go to a chiropractor and every time he adjusts this left ilium here? Because you've probably developed a pattern to where this left ilium always goes back out of place even though you adjust it. Well, how that can happen is that, for one, there could have been an old injury to this a long time ago. And so what it did was it threw it out, and over the years you adapted to that, and your muscles, ligaments, and tendons stretched and contracted and tightened, and it grew around this new position. Therefore, when you get adjusted, it's like, this is unfamiliar. I'm going back to my old comfortable position that I've been in for years. I don't like this new position, even though that's the correct position. So, but it may be your feet or the foot on this side. You could have an arch that's dropping. You could have an ankle that's curving. You could have a knee issue that's messing up the movement and stance of this leg. Therefore, it's going to throw this out a lot easier, and you're favoring it. It could be the way you sleep. Your positioning in sleep. It could be the way you're sitting in your car. It could be the way the office chair is. So, but think about this. So if everything is adjusted and everything is fairly good and no injuries or anything, and it still goes out, okay. So muscles, you do know, muscles connect to bones. And so there's a lot of muscles in the back part of the pelvis and the front part. Well, if you have muscles back here that are all working correctly, and somewhere along the line over the last few years, you strain some muscles up here. When you strain a muscle, the nervous system shuts off the signal to that muscle to reduce it, so it doesn't have a full contraction. And so, because it's kind of like the breaker box in a house, it saves the circuit so it pops, and so you don't get the flow through there. It's not an anatomical. What it is it's a feedback mechanism which the body is saving parts, so it reduces the contraction of the muscles in the front. Well, So let's say these muscles are working perfectly well and strong. These muscles, or a few muscles here, have been shut off because it was an injury to them. So they're not tone and taut. And so when that happens, so you can just picture good muscles here, and these muscles can't contract and keep a balance. So it's like a big TV antenna, you know, those guidelines, the wires that hold it straight. If one is loose, then the others, then the antenna is going to be pulled to the side of strength. So that allows this to go back because these are not strong. I don't know if you can see that. There you go. So these aren't strong. And so you can adjust this every single day. And then by that time, you're wearing on that joint, and you're also, it could create hypermobility in this joint, and then it goes out all the time and it doesn't stay. But what you could do is work these muscles. Now, I'm not saying go exercise, because if these muscles, now, I'll take that back. So if the muscles have been shut off due to an injury, you cannot exercise those muscles back to a strong state. You have to get a muscle activation technique that turns on these muscles. Then you can exercise them and tone them. But it could be just from atrophy, even though the muscles are not turned off, and a lack of exercise. Then you can exercise it and then it's strengthened. But most cases, it's muscles that have been neurologically shut off, and they don't have just good idle tone, and therefore they won't give the opposing force against the stronger muscles in the back. Because if they were both strong, it's held straight. If these are weak, that pulls back. So hopefully that answers the, can I fix an SI joint? I address feet, knees, muscles, pelvis, leg length, and not only that, but those muscles that I'm talking about, they're also related to certain organs. Well, if that organ is not working right, then that muscle is not going to work right. And that could be where the issue is. So to make a short, simple answer into a long, question into an answer, hopefully I didn't take up too much of your time, but maybe you understand now why it is not just here, put it back in and it stay in. It takes some work to resolve those kinds of issues. So if you think you have that and you're not getting it addressed somewhere, call me and we'll do an exam and I'll figure out what is really going on. Some people have, some of my patients have that chronic positioning, that pattern, but I try to suggest, hey, there's more to it than just this. They choose not to. Some do, and some don't. But it's up to you to choose if you really want to go and completely do 100% of the job or only 50% of the job. So if you want to fix it, definitely call me. We'll get you in. Have a good one. See ya. Bye.